This is Lenny Sanacola for World of Work TV, and today I'm with Tracy Watts from Mercer. Tracy, I know Mercer does their annual survey on employer-sponsored health plans, and I know one of the results this year was that telemedicine seems to be the fastest growing part of healthcare delivery. Can you explain why you think that is? And I'm also curious to know if a lot of the telemedicine vendors are working directly with employers, or are they working through insurance carriers to deliver their service?
So, Lenny, you're correct. Telemedicine is one of the fastest growing trends according to our survey. I think the big reason why it is such an important new addition to the healthcare benefit program is that it provides a very low-cost way to access care for a whole array of typical things that somebody would perhaps go to their primary care physician for. The cost point is much lower, typically around $40 for a telemedicine visit, but most importantly, it can be scheduled almost instantaneously. Typically, there's not a long wait once you go online to schedule the visit. You can usually get one, within the next 30 minutes to an hour, or scheduled at your convenience. And you can do the visit from any place you want to, from your home, from your office, wherever makes the most sense for you. From the plan member perspective, it's low cost, quick and easy, very high satisfaction accessing care that way. From a plan sponsor perspective, low cost and not a drain on productivity because the person most likely is scheduling the visit during off hours from business hours. So just an overall win-win. In terms of how the telemedicine programs are sponsored, a lot of employers are accessing them through their carrier. Most of the carriers make them available. There are some employers that before the carriers did that were out in front and contracted directly with a telemedicine vendor. There are also cases where an employer might work with multiple carriers, but they want to have the same telemedicine vendor platform across multiple carriers. So there's different strategies around that.
Now, I know also in the survey, approximately 25 strategies were identified, best practice strategies that were identified that helped employers sort of keep the medical trend low and keep kind of cost sustainable in 2015. Obviously, telemedicine was one of those strategies. What were some other strategies that the survey showed?
I think the number one strategy for employers in 2015 and in 2016 is making the offer of a consumer-directed health plan. We actually saw a 10% increase from 39% to 49% of employers offering a consumer-directed health plan in 2015, and so that was significant. We know from the analysis that we've done of the 25 best practices, that's an analysis that we've done for the past 4 years, and we've consistently seen the same findings. And in the most recent analysis, the employers that were in the top quartile of those 25 best practices had on average 5% lower per employee claims costs for medical. And so there's definitely some proof to taking that approach.
Centers of Excellence, let's talk a little bit about that. That also is an approach or a strategy that some employers have taken over the years, typically for hip and knee replacements, but my understanding is that we're starting to see other types of conditions being addressed through COEs. Can you talk a little bit about that?
Yeah, Centers of Excellence actually go back many, many years. The earliest ones were for transplant programs, and you can imagine that certainly if you're a candidate for a transplant, you definitely want to go to a Centers of Excellence. That's not the type of procedure that's done everywhere, and that has expanded out, as you said, into hip and knee. We see them for circulatory, but really number two behind Centers of Excellence for transplants are for bariatric surgery. Again, a specialized type of procedure, one that requires quite a bit of counseling before you actually become a candidate for the procedure. And so we see a number of employers, I think almost half, taking advantage of Centers of Excellence for bariatric.
Now, you mentioned consumerism continues to grow, the growth of CDHPs. But some of the cost transparency tools that are supposed to help consumers are still somewhat complex and not as user-friendly to navigate. So let's talk a little bit about engagement and changing behaviors. Did the survey reveal, or just from your own experience, anything about employee engagement strategies and how we could do a better job of really getting to that consumerism?
Yeah, I think that historically our way of communicating with employees was primarily at open enrollment time, and it was primarily to impart as much information as we possibly could at open enrollment. And what we've all learned is that if you can serve up topics in a timely manner, that people, if they're interested, they will click to learn more. And so I think the approach has changed a little bit in two ways. First, this idea of just serving up the topic rather than trying to communicate everything. And secondly, many employers have tried to be more personalized and more targeted in their communication efforts. And so, they're using digital platforms to be able to do that, perhaps integrating programs and integrating them in with their incentive programs. We've become a lot more sophisticated in how we're communicating with employees, and we are seeing that pay off in higher engagement levels.
Let's talk a little bit about the marketplace. There's lots of venture capital out there, and there seems to be a lot of startup these days, specifically in the wellness space, but also in other areas of healthcare. From a practitioner perspective, employer perspective, getting calls from a variety of potential service partners, and a lot of them are niche-oriented, diabetes management, obesity management. Do you have some tips for employers on how to perhaps vet these potential service partners and how to make a decision of whether or not to integrate them as a solution into what they currently do?
Yeah, innovation is definitely thriving in the health benefits industry. We've seen about, I think, $6 billion that's been pumped into healthcare innovations through venture capital in the past 2 years. So a lot of players out there going after that $3 trillion plus in healthcare spend. From an employer perspective, and giving advice to employers that want to take the first step into taking advantage of an innovation, I would say start with where your biggest pain point is. Look at your data and decide, do you want to engage in something that focuses on a specific chronic condition? Is your pain point more associated with the 20% that drive 80% of your healthcare spend? What is it that would really make a difference for your population that you could potentially measure and use that success to be sort of that fuel that you might need to lead you into your next round of innovations? But start with where you think you can have the most impact.
My final question, Tracy, is more futuristic. So obviously lots of volatility here, lots going on in the healthcare marketplace from both a plan design and a delivery perspective. But looking into the future, what do you see as sort of being the top trends or drivers that's going to occur in the marketplace?
Yeah, I think that in the most traditional sense, employers will be very focused on what's going on from a care delivery perspective. We see so much going on with providers organizing to provide more efficient, more integrated, higher value care to plan members. And so obviously that's very important. It's very complicated for us to get our arms around and to make smart decisions. But beyond that, being very futuristic thinking, I think we need to be really mindful of what is going to be happening at a grassroots level. There are so many different things happening at that retail level, so many different places that somebody could access health care, and such a broader definition of health care, not just care when you're sick, but things associated with nutrition, with your well-being, with everything that's associated with you and your overall, not just physical health, but emotional health and financial health. And those are all going to start to morph across each other. And so I think it's going to be really challenging as we try to develop programs that are responsive to the needs of our population, to stay on top of the latest developments there in a way that is just at your fingertip from a technology perspective, that you can just click into access, of the easiest of ways. That's a big transition that we're going to have to make.
The world is definitely changing, and we didn't even touch on the legal regulatory environment. Thanks, Tracy.
Thank you.
For World of Work TV, this is Lenny Sanacola.